Hello everyone, I'm Rebecca Ellis, a PhD student at the University of Swansea. I've just started my third year at the College of Human and Health Sciences, co-producing and improving care pathways for autistic children. Today I would like to discuss the overall aim of my PhD, give a brief overview of the scoping review conducted last year, take you through the questionnaire for parents I'm currently working on, and the steps I want to take from there. The overall aim of my PhD is to aid communication between stakeholders in the care pathway for autistic children. The first step in this process is to find out what we currently know about care pathways, what's currently out there in the literature. So I conducted a scoping review. In order to fully understand a care pathway, literature must detail its process, workforce, and information on empirical evaluation. It is currently unclear what information exists on care pathways for autistic children, and there is a limited understanding of whether their use leads to improved care. The scoping review conducted in February of last year following the Arksey and O'Malley methodology aimed to address this obscurity. I wanted to identify how care pathways are being defined and discussed in the literature, identifying which of these, if any, had been evaluated and which included multidisciplinary teams. I used the scoping review to enable me to capture the academic and grey literature, which included policy documents from the UK and other countries. A total of 71 papers were included in the final review. 35 papers explicitly detailed care pathways, but the definition for a care pathway was so broad and varied that 36 other papers were also included because they discussed care pathway-like systems. Only including papers which explicitly labelled their system as a care pathway would have been very limiting. Of these 71 papers, only 7 detailed and then evaluated a full care pathway, spanning from assessment all the way to post-diagnostic support. The majority of these evaluations were qualitative interviews with parents and the professionals involved in the current care pathway. In terms of incomplete pathways, which only cover 1 or 2 of the assessment, diagnostic and post-diagnostic subsystems, there was a notable bias towards assessment and diagnostic stages being paired together, with much less focus on the structure in place for post-diagnostic support and how these interact with the previous care pathway stages. When looking at literature which included a multidisciplinary element, the definition of multidisciplinary was also quite broad. Of the 71 papers included in this review, 49 had a multidisciplinary element included. 24 of these papers mentioned multidisciplinary teams and practice, noting the importance of their usage or recommending them to be integrated into autism services, but not giving any further detail as to how this could be achieved. 10 of the 49 papers met the criteria of including a multidisciplinary element because of their use of a multidisciplinary participant pool, consisting mostly of parents and professionals. Of the 15 papers which explicitly detailed the professionals included in their multidisciplinary model, 10 of these were focused on the assessment and diagnostic subsystems of the care pathway. Despite the current rhetoric around the need for multidisciplinary and integrated services, gaps in these services were still apparent, and care pathways which covered assessment through to post-diagnosis and had been empirically tested were rare. This variety of information provided was also apparent in the government documents included as grey literature. The next stage of the research was a questionnaire with both open and closed questions, available in both English and Welsh, for parents across Wales to determine the state of the current care pathway for autism. This questionnaire aimed to see how much uniformity was present across Welsh regions in terms of diagnostic practices, professionals involved, and support given. This questionnaire wished to gain not only feedback on which elements of care were working, but also which needed improvement. A link to the survey was distributed to multiple support groups over social media such as Twitter and Facebook. Unfortunately, the questionnaire was published on the week the UK went into lockdown. Parents of autistic children now had their autistic children at home, trying to deal with the sudden change and uncertainty, and therefore, obviously, adults had much less free time to take part in the research. Because of this, we got fewer participants than anticipated. To counteract this, we contacted autism organisations and Facebook support groups directly to advertise the research further and published the Welsh version of the questionnaire. We also kept the survey open for longer than originally anticipated. It's actually still open and links are available on my Twitter. Looking over preliminary data, we so far have 52 participants from a range of locations across Wales, with a range of autistic representation in terms of the child's age, gender, and level of support needed. Results are obviously preliminary, as we're hoping to gain more participants with children going back to school in September, freeing up some time for their parents and carers. But as of the end of August, we can already see differences in experiences of parents with regards to professionals interacted with, diagnostic assessment of their child, training and support offered, and educational provisions given post-diagnosis. In terms of the qualitative questions, the themes brought up were similar to those outlined in the scoping report, such as the need for improved communication and support for the family. Satisfaction seems to be greatly varied dependent on the region, local services available, and the school's understanding and provisions. The next step for the research is to take the themes which stood out in the questionnaire and ask parents for more in-depth information on these. This stage of the research not only wishes to elaborate on which elements of care needed improving, but how this could be achieved and what a parent would want something like better communication and support to actually look like. Once these specific actions and recommendations have been collected, another stage of the research can commence, asking other stakeholders about their experience of the care pathway, adding clarity to their individual roles and responsibilities, and establishing what positive change would look like to them. Thank you very much. Here are references for the methodology for the scoping report and 2 papers which were jumping points for the PhD research. Thank you very much.